Health. This morning, the CDC announced confirmation of the second case of novel coronavirus in the U.S. and the first in Illinois. The patient is a Chicago resident. This is a single travel-associated case, not a local emergency. The patient is a woman in her 60s. Most importantly, I'm pleased to report that she is clinically doing well and is in stable condition. She traveled to Wuhan, China in late December and returned to the U.S. on January 13th. A few days after arriving home, the patient began to feel unwell. She called ahead to alert her doctor to her illness, rather than just presenting to a clinic or emergency department. The patient is clinically doing well. She is currently in stable condition and remains hospitalized primarily for infection control. She was not symptomatic when flying. And based on what we know now about this virus, our concern for transmission before symptoms develop is low, so that is reassuring. But we know already, for example, that she has not taken public transportation. She has not attended any large gatherings. And actually, to our best knowledge at this point, she has not had extended close contact with anyone outside her home since returning from China and prior to admission to the healthcare system. Yep, so if folks heard on the telebriefing this morning, the CDC did say that they have 63 patients under investigation across the U.S. From 22 states. So this gives you a sense that although this case is second, we would not necessarily be surprised to see some of these other labs turn positive in the next few days. We've talked a lot